Alrighty, so next up is going to be medications and treatments, DME. So for LVNs, and for RNs, this is going to be for both of you guys. Go to current orders. This is after, coming in from patient demographics into this area. Current orders. This is unpopulated at present because there's no orders, of course, and we got to put in some. So let's start off with the main ones for everybody, which is new physician order. Now we have our orders. You start off by saying who ordered it and give it a date. And after you've done that, as you can see, you must save the form before entering new orders. Save. Good. Open this up. And this is where you put in all your stuff. Enter new order, view current order. This is where you put all your things. So let's go to meds, because we're doing medications. And let's say omeprazole. So as you fill this out, the list will populate. Of course, omeprazole is very common, so they even have ones that are like the branded ones. You kind of want to steer clear of that. 20 milligram capsule. There you go. And so this is where someone's own personal practice can come in. Personally, I like to have the whole order in this bit right here, because you can fill things out in here, but sometimes it makes it easier if just the whole order's one lump sum. So 20 milligram capsule, give 1 capsule by mouth twice a day. Okay, pretty simple. You can add indication. You can put it right here. You can add indication right here, but usually it's good enough just like that. So next up, these things you don't really need to fill out. You can put new. If you're doing a discontinuation, you can use that, of course. Payer, don't worry about this. Personally, myself or an RN case manager usually has to worry about this kind of, but not so much. This is more so we usually just communicate this kind of stuff. It's hospice, individual, private, or hospice insurance, private. And then here, whoever the pharmacy is, really, it's only ever going to really be concierge pharmacy. Sometimes it's infusion, but that's like twice a year, and usually I'm the one dealing with it, so you don't have to worry about that. And then administered by. This is for RCFEs. If the patient is in a good old-fashioned RCFE, these big box facilities, usually you'll do this one, self, FAM, PCG, and hospice nurse. The reality is that RCFEs are not allowed to administer. It says administered by. They're not allowed to administer. They're only allowed to assist in administration. So that's where you need to make sure that it's not just like staff. This is going to be either FAM PCG and hospice nurse or self-FAM PCG hospice nurse, depending upon whether or not the patient is in an RCFE and whether or not the patient's sound of mind. So, I mean, I'm good enough in terms of for sound of mind, considering this is for me. And today, there we go, and that's pretty much everything that needs to get done for now. If it's an antibiotic, let's say, then that's where I'll add a stop day, because usually antibiotics are, terminated after 5 days or a week or so. So, okay, we're all done with the order, all nice and neat. Go to add new order. Okay, and this will populate with the order you just did. Let's say you need to edit it, then that's where you do select. This has come up. Let's say I need to not, start it tomorrow, or I needed it once a day and I misread the text from the doctor, or whatever. You don't do add new order if you're updating it. You do update order. So this gets changed to the right order. Okay, so there we go. We got that. Let's add some more things. Let's do, I mean, LVNs sometimes deal with diet. Sometimes. So this, the vendor doesn't really matter all that much for this kind of thing. Start day, diet, we're just doing regular or aspiration precautions, that kind of thing. Now let's go to a different one. Treatment. This is going to be for wound care kind of things. And then, that's kind of all you're going to be dealing with. DME stuff is dealt with by intake coordinator. Supplies is, you don't need orders for supplies really. You just let the home health aide know or bring them yourself, so on. But that's pretty much that. Let's do a PR and medication. Let's do Zofran. So 4 milligram administered by self-fam PCG hospice nurse. Zofran 4 milligram. ODT, orally dissolving tablet. Take 1 SL. Let's do PO SL Q 8-hour PRN nausea. Okay, so take 1 POSL Q 8-hour PRN nausea. So we got the 4 milligram dosage. This populates automatically. I'd be careful for some medications because the strength and whatnot is wrong. And if it is, then what I would do is I would just honestly delete this stuff because it's not completely necessary if you have it listed in here. And then beyond that, you do as needed right here. It's got the indication, it's got, route and dose and right med and all that sort of thing. So that's pretty much good. And then you add new order. And there we go. So we got our 2 medications. Okay. Now, once you've completed all the medications, sorry, you are to, usually this is done over the phone. You're the one filling this out. If the physicians rarely are the ones, finagling with this EMR. So go to phone order, read back order, basically TORB. Save after you've done this. Okay, this will come back so that you could sign it. Sign it, and that's pretty much it. For instance, if it's an RCFE or something or a facility, they usually require the doctor's signature to be on it. So that's where you need to inform the office so that they can get it signed for you by the doctor and all that. I'm not going to sign it because that makes this kind of permanent, and I needed to be able to remove this order. So that's pretty much it for this one. Just as a side note, actually, so if you want to get rid of something on here, you just press a little X. And let's say you had a comfort kit, and you don't want to manually input every single thing. You go to, go back to here at the enter new order, view current order, import edit comfort kit, and up here you put in the date. You do not want to do anything with these drop downs or these boxes. So let's click one. It has the instructions up here. The reality is this is meant to be for everybody. Don't be adjusting these because we're automatically just going in here and doing the import. Do not change any of this stuff. Do not change any of these in this particular window. If you want to change them, just do it after the fact. So we have it for today, import now. And as you can see, this thing's repopulating, and there we go. We have all of our medications. Let's say it's, where's the Ativan? Where's the Ativan? Morphine, atropine. What the heck? So I think I'll have to add it. Oh, maybe it's just not automatically in there. Anyways, I think I will have to add it. So I'll do that later. So that's there's a reason why you don't edit this stuff in here, because you end up having issues down the line because people think that it's complete comfort kit according to our comfort kit that is associated with the pharmacy that we work with. But anyways, so let's say there's a medication in here that the facility doesn't want, such as Ativan. You'd go to the one that they don't want or you don't want, and if you don't have any other meds you want to like change this into, such as select Ativan 1 milligram tablet, and it already, so you need to get rid of this stuff. This is why. So Ativan 1 milligram tablet, give 1 tablet by mouth, Q4 hours, PRN anxiety. Yeah, there you go. So now remember, if we're changing something, we do not do add new order. You can do add new order if you don't want, like if I did this right now, it would add the Ativan. And this would stay here just as it is. If I do update order, it will just change this order to whatever I want it to be. So I'd rather do add new order because honestly it's Ativan, so you need to have, usually you have Ativan and morphine on board. So add new order, and with that we have the old morphine, and now we also have the Ativan in here per our instruction. So okie doke. So that's pretty much it. That's the bread and butter for medications, and everybody needs to be doing, this is one for everybody. But I'm going to go ahead and delete all these because I don't want them on file. There we go. Okay. And I'm going to close this, and we're good with that. So that's medication orders. Let's say you needed to look at orders, for instance, that were backdated or that were discontinued. That's where you go to order history. There's nothing in here. Well, there's stuff in here. There's this stuff for today. Okay, there we go. So I don't really have anything in there. You know what? Let me show you something for. Yeah, no, we'll leave it at that. Okay, great. Well, that concludes medications, treatments, orders. Let's move on to the next thing.